What's up, Doc Mike? Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for March 4, 2021. Caution and COVID-19, why vigilance still matters. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, the producer of Public Health on Call. Today, Dr. Josh Sharfstein is speaking to Dr. Lisa Maragakis, the Director of Infection Prevention at the Johns Hopkins Health System. Remember that time when the Dallas Cowboys football player celebrated a sure touchdown too early and fumbled the ball? Dr. Maragakis does, and she's thinking about it these days with respect to COVID-19. Let's listen.
Dr. Lisa Maragakis, it's great to talk again. How are things going with COVID at Johns Hopkins?
Thanks for having me. We are heading into brighter days. The numbers of cases and hospitalizations are coming down, thankfully, and we are so grateful to see this. Everyone is very tired, so it has been a long winter so far, but we're really pleased to see the numbers improving.
What's morale like inside the hospital? Do people feel that sense of improvement, or is there just still such total exhaustion?
It's a bit of both, but I think hope wins the day, and people are very hopeful. We have had a vaccine rollout, primarily starting with frontline healthcare providers, and so that really brought a lot of optimism and hope and protection to the workforce, and so that's great. But it's been many months, and so people are very tired, and we know that everyone's tired of the restrictions and the desire to get back to normal is just an overwhelming force right now.
So were you there when the vaccination started at Johns Hopkins Hospital?
Yes. I'm part of a group that helped to facilitate that. And it was an enormous operational project to stand up the infrastructure to properly care for these pharmaceuticals that must be frozen and distribute them throughout our health system. And, we have an enormous team that has done a fabulous job of all of the details of that.
So I imagine that you were there for some of the first shots that were given to healthcare workers who had seen hundreds of people with COVID and many of them die. What was that like?
It's been such a ray of hope in this very dark time, and everyone is very excited that the vaccine is here and that the data are so good. And I have to say that it was very emotional for our staff to have the opportunity to be vaccinated, to know that protection is here, that it's the beginning of the end of this situation. And as you say, after so much death and tragedy around this, it is truly emotional for people to have the opportunity to be vaccinated.
I'm sure many of them were worried about their own safety for many months.
Absolutely. The fear has been palpable in our hospitals and health systems since the very beginning. And the frontline personnel have been incredibly brave and incredibly dedicated to their work. But this is an enormous relief to have a vaccination and some protection.
Now, the existence of the vaccine, the strong data behind it have led to vaccine optimism, which, it entails in part really seeing the end of the pandemic. How do you see the value of the vaccine? Do you think it's fair to, at least on the horizon out there, see the end of the pandemic with the vaccine? What's your general sense of where things are headed?
My general sense is that we are on the right path, but we are proceeding down that path slower than I would wish. And there is the real sense that we are in a race with this virus. The emergence of variants has been well publicized, but is continuing. We're watching evolution in real time as this virus mutates, and selective advantage is given to some of these variants. And so this is a threat.
So let's talk about that race. Tell me about the humanity side of that race. What do we need to do to win the race?
So we know what the virus is doing, but what we need to do is two things. One is to persevere in our infection prevention. So keep doing the things that have worked to control transmission of the virus. And those are the very basic infection prevention measures like masking and physical distancing, all the things we've been doing for these many months. And then the second piece of it is the vaccination rollout and conferring immune protection to as many people as we can as quickly as possible. So that's the way that we can win the race.
Do you see one part of the race making sure that the vaccine distribution is equitable and that the communities with very high rates of coronavirus are actually getting protected too?
Absolutely. That has been one of the major challenges and continues to be one of the major challenges. So we know we want the numbers to be as high as possible. And so there's been a push for vaccines in arms and just the raw numbers. But those of us who are working on the vaccine rollout are acutely aware that we need equitable distribution of the vaccines and to get them to the people who are at the highest risk of catching the disease and dying from it.
So the FDA is reviewing and as we're talking, expected to authorize shortly a third vaccine. The Johnson & Johnson vaccine is just one shot. Do you think that will help with the race?
Absolutely. We're thrilled to have another type of vaccine joining what we already had from Pfizer and Moderna. We're hoping that production of all of these can ramp up, and we're looking forward to good news if the FDA does authorize Johnson & Johnson.
So there's some people who say, like, look, we've got this race won. Look at this. We've got a great vaccine. We're going to have another one. The numbers are dropping so quickly. Why are you so worried about the virus side of the race? What's on the virus side of the race?
You know, I keep thinking back to my days in Texas of a football game that the Dallas Cowboys played when celebration prior to the end zone led to disaster. And that's my fear right now, is that if we let our desire to get back to normal and to roll back our restrictions win the day too early, then we will risk this wonderful outcome that is within our sights. And so that's why I'm urging everyone to persist in the precautions and have some patience while we do the vaccine rollout. You know, right now we've only vaccinated about 5 to 6% of the United States population fully vaccinated. And I think 14% have gotten their first dose. But it's at the current rate going to take us months, actually 10 months at the current rate, to get to anything close to herd immunity. And I anticipate that we'll be able to accelerate that, but we're just not there yet.
There's a lot of virus still out there.
There is a lot of virus out there. So we've seen sharp declines, which are wonderful and greatly needed. But we have to remember, we're still seeing almost 80,000 cases a day and 2,400 deaths a day. So we're still at a very high level. And we really need to drive that down much further before we let up on any of our efforts.
So we're seeing things move in the right direction. There's a temptation to slow down some of these restrictions. And to some extent, some of the restrictions may no longer be necessary. But what I hear you saying is that this is a moment for us to finish the race and not start dancing on our way to the finish line.
Absolutely. And, you know, I think it may sound corny to say, but we really are all in this together, and it needs to be a coordinated effort. We need to think about, as we are vaccinated, to think about all those who are not yet vaccinated and the risk that letting down on precautions poses to those other individuals while they're waiting for their turn. So I just urge everyone to think collectively, resist the temptation to let up too soon, because I do think that we can beat this.
Now, you have been just absolutely immersed in the fight against the pandemic now for a year, basically, at the time that we're talking, maybe more. What is your mental state like as you look forward? I mean, how do you bring these different feelings together, the optimism of the humanity side of the race, the pessimism of the virus side of the race, the variants, what do you want the Public Health on Call listeners to know?
Well, I think we're all tired and we all definitely want the end of this. And I put myself in that category as well. And so that's part of the urgency of this message, because I do want to get to that day. And I want to get to the day when we're back to normal sooner rather than later. I think that if we all follow precautions and have patience and roll out the vaccinations as quickly as we can, and everyone steps forward when it's their turn, that we can get there in the next several months. I'm looking towards summer and very hopeful for the fall. But I just have that fear, I guess. I'm tired. I have been doing this for a long time. And my concern is that we will lose this opportunity and see yet another surge due to the variants. And I don't think any of us want to go back there.
The goal here is not to steal defeat from the jaws of victory.
Absolutely.
Thanks so much, Dr. Maragakis.
Thanks for having me.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.